Good day, dear friends. Last week we had lectures about digestive system, and today we have lectures about anatomical physiological features of cardiovascular system in children. We have several chapter of our lectures. It's fetal blood circulation, anatomic and physiological features of cardiovascular system during childhood, and method of investigation of cardiovascular system at children. Formation of heart and large vessels in uterine periods of childhood, stage of childhood. The line formation of heart and large vessels occurs at third week of embryonic phase. The first contraction of the heart, two-chamber variant of heart, occurs at first week of the embryonic phase. Listening of heart sound through the abdominal wall of the mother is possible from the fourth week of pregnancy. It's very important to understand when we can found this phenomenon. Fetal blood circulation. The need for an intrauterine type of blood circulation is determined by the existence of a placental rather than autonomous type of mammalian activity before birth. You can see a very important part of fetal blood circulation, especially blood from interior vena cava mainly passed to the foramen ovale. Blood from superior vena cava mainly flowed into the right ventricle. And from this it passed right ventricle and passed from foramen ovale into left atrium to left ventricle to pass. The first phenomenon in the related to features of intrauterine circulation is bifurcation of umbilical vein carrying arterializate oxygen and enriched with nutrient blood into two venous vessels from umbilical. One of flows into portal vein which carry blood to the liver, the same to the liver, and the second virus of Arantius duct. Arantius duct is the same. Flows into inferior vena cava, which carried blood to right atrium. The second phenomenon, in the right atrium, the cord blood flow does not mix with the rest of the venous blood. This is achieved by exercise a special valve in atrium. Thanks to foramen ovale leading from the right atrium to the left. And the third vascular phenomenon is provided. Arterial blood which is so necessary for intensively forming fetal brain, enters the ascending part of aorta and the large main arteries extending from its arc, да? Each arc. No. The first phenomenon of uterine circulation, venous blood under conditions of intrauterine development almost does not enter the capillaries of alveoli since the lungs don't participate in the gas exchange. Most of the ejection of the right ventricle during intrauterine circulation is discharged through the white vessels called Bottalov. You can see between the right arteries and aorta, leading from the pulmonary arteries to the aorta. There's the umbilical cord blood cycle associated with fetal systolic blood flow ends. Systemic. The oxygenation. All organs of fetus receive mixed blood. You must remember about it. Mixed blood, not arterial. Maximum oxygenation in this case of liver, brain, and upper extremity. Relatively bad minimal oxygenation, its lung, low part of body. And such as result, we have a ratio between different part of body, anatomical part of body, and more have more size for liver, brain, and upper extremities of fetus, and relatively low size for lungs, low part of body. The level of oxygen saturation of blood in umbilical vein depend of gestation age. In 22 weeks in umbilical vein we have 60% of oxygen, and just in 43 weeks it's over the normal pregnancy, just only 30%. In umbilical arteries, when flowers change to this return, 22 weeks 30%, 40 weeks 25%, and after 43 weeks only 7% of oxygen saturation. Portional pressure of oxygen arteriovenal different approximately 20%, came with adult approximately 20 to 30%. The umbilical vein blood 21 to 29 millimeters of mercury, and heart 42 to 45 millimeters of mercury, and umbilical artery also. The factors of adaptation of fetus to futures of blood circulation, big surface of placenta, intensity of blood circulation, high level of fetal hemoglobin, high level of erythrocyte, and high activity of fetal hemoglobin. It's main factors to adaptation of fetus in uterine live. The blood circulation of newborn. The blood circulation of newborn, it's a short characteristic. uh, transitory conditions for cardiovascular system: stopped placental blood circulation, closed arterial and venous ducts, foramen valve. Its main transitory conditions of cardiovascular system when transfer from intrauterine to extrauterine phase of um, baby's life. Changed character of working chambers from parallel to consistent. Whole volume blood circulation through the lungs. Volume of blood increase in 5 times just after first several breath movement. The volume of blood circulation through the lungs increase in 5 times. Volume of fetal blood circulation through the lungs just only 10% from whole blood volume. And now just after birth increase in 5 times. Decrease vessels resistance in lungs in 5 to 10 times. Increase necessity of in oxygen. Increase stroke volume and systemic vessels pressure. Increase oxygen pressure, dilatation of nucleus artery and arterioles. Increase volume of blood in the left atrium and decrease blood pressure in inferior vena cava, closed foramen ovale. But it develops pneumonia, distress syndrome, shunt if develops pneumonia or distress syndrome at newborn. Shunt may be closed later or recommence. Rarely, anatomic closing of foramen ovale happens later. Circulation stopped earlier than anatomical closing of foramen ovale, for example, later. 50% till to 5 years old, 10 to 25% adult have opening non-functional foramen ovale. Non-functional of foramen ovale. Anatomic particularity of cardiovascular system. The mass of heart. In anatomical terms, the heart of the fetus and newborn is relatively larger than adult. In newborns, 1% from the body's weight, and for adults, only 0.4% from body's weight. And in really average newborn mass of heart 26 gram, 1 years old increase to 42 grams in average, 2 years old only increase in 2 times after newborn in 56 grams, 12 years old 75 grams. You can pay attention just in 13 years old 190 grams and 16 years old in 2 times increase than newborn period 260 grams and 18 years old 300 grams is nearly mass of body of adult. Left and right ventricles are approximately the same. The mass of left ventricle is increased in 3 times heavier than a right one in 16 years old. Just only in 16 years old. The third point, the muscles fiber has very thin and very poor bending. First point, increased diameters of conduction cells. Fifth point, increase the enrichment of heart by connective and elastic tissue. Connecting interelastic tissue. Its anatomical features. The temp of enlargement of the great vessels is less than enlargement of heart. Heart more enlargement than great vessels. The volume of heart is increased in 7 times till 15 years old, but diameters of aorta increase only in 3 times. The position of heart more cranial than horizontal. Nine points. The shape of heart is spherical, then pear-shaped form. The borders of heart are changing due to rotating and decreasing of size of the liver, increases of left lung. Features of myocardial blood supply. The coronal vessels of the heart is 2 years of life are distributed according to Lewis type. From 2 weeks to 6 years according to the mixed type, and just over 6 years old according to the adult, the main. The occurrence of ischemic myocardial infarction typical to adult in children is casuistry. Also, the rare malformation can occur in children. The passage from coronary arteries into pulmonary artery may be such as adult problems. Myocardium muscles of fiber of the children's heart are thin, don't have a transverse striation, contain a large number of nuclei. In the first 2 years, the child life intense growth and differentiation of the myocardium occur. Muscles fiber sinking 1.5 of 2 times the transverse striation appears, and connective tissue septa from. By 10 years, the histology of heart correspond to that in adult. To the just only in 10 years old, the histology of heart corresponds to that in adult. In parallel to the age of 14-15 years old, the development of histological structures of cardiac conduction system cardiac conduction system just correct after 15 years old, correct to such as adult, which is a specialized myocardium devoid of contractile function. The heart of borders of heart. The heart of a newborn is high. The projection of the heart into spinal column is localized between fourth thoracic and 7 torque and lies transversely. The apex of heart is projected from left fourth intercostal space. The upper border of the heart is at level of the first intercostal space. From the first month's life it drops to second rib. The left border of the heart goes beyond the mid-clavicular line and the right beyond the right edge of the sternum. It's the main border of heart. Anatomical border of heart according to age. Upper border of heart is located in the first intercostal space. It's at newborn baby. In the second intercostal space and first month years old, and in the third intercostal space up to 7 years old. Apex of heart of newborn is formed with left and right ventricles. 6 months with left ventricle only. From 6 months, yes, from 6 months old with left ventricle only. A projection of apex of the newborn is located in projection or apex of heart, located in the first intercostal space, 1.5 years old, in fifth intercostal space, and elder children they also in the fifth intercostal space. Vessels features. With age, the diameters of vein and their length increase. After birth, the topography of superficial vein of body and limbs changes. Newborn have well-developed thin subcutaneous venous plexuses, large veins, and poorly contoured. They become clearly visible only after 1-2 years. Become clearly visible after only 1-2 years. The capillaries in children are wide, have an irregular shape, short, crimped. Their permeability is higher than in adult. Differentiation of arteries and venous networks consist in the development of collateral vessels, the formation of valve apparatus in the vein, in an increase in number and length of capillaries. Physiological features of heart. Physiological features of heart. The same. Heart rate is higher than younger the child due to a more intensive metabolism and predominance of sympathetic influence of heart. In age-related decrease of heart rate occurs as volume of chambers increase. The stroke of volume of heart and the influence of parasympathetic department of the autonomic nervous system on cardiac activity increase. Heart rate in children is more labile, increase with a change in body position, screaming, fever, and other factors. Children are characterized by respiratory arrhythmia, increase in the heart rate in inhalation and decrease on exhalation. In children over 15 years age, respiratory arrhythmia is less common. Characteristic of pulse. Newborn's pulse has a physiological arrhythmical characters and more rapidly then decrease because in nervus vagus interventions is developed and increased stroke volume. A very important table for you understand it's parameters of pulse rate per minute for babies with different age. Attention for newborn and especially early age children, early age children. Newborn pulse rate between in average between 140 to 160 per minute. During first years old, from 120 to 125 per minute. In second years, just only 110 to 115 years. In 3 years old, 105 to 110 pulse rate per minute. You can see parameters of pulse where we change pulse. In 5 years old, it's nearly 100 per minute. 8 years old, 90. 10 years old, 80 to 85. 12 years old and older, 70 to 75. No, after nearly 18 years old, the pulse rate is the same in adult. In average, the pulse of adult between 60 to 80 per minute. Blood pressure. We have two parameters of blood pressure: systolic blood pressure and diastolic blood pressure. You can see a formula which how calculate what must be parameters of systolic and diastolic blood pressure for children to different age, till to 1 years old and above the 1 years old. It's also very important table with a stroke and mean volume of circulation, blood circulation. It's the result for in milliliters. It's stroke volume and minute volume in milliliters per kilograms. Different parameters, in the absolute and relative, Absolute in stroke volume, it's volume of one times volume of output from baby's heart. you can see that increasing many times just in 4 times just in absolute parameters, just from birth to 1 years old in 3 times, 4 times. In adult, its parameters increase than newborn in 20 times. Absolute volume and relative per milliliters per kilogram, it's just opposite in increase for newborn and low for adult. We should small the small rest, only 10 minutes, and continue after pause. Okay. Okay, continue our lectures, please. Now you will see a table about stroke and minute volume of um, blood circulation by the heart. Method of investigation of cardiovascular system. We have a clinical method of investigation according to um, discourse with patient and instrumental and functional method of investigation. The first time we uh, take complaints from patient with problems of cardiovascular system. According to cardiovascular system, we can check weakness, improved sucking, fatigability, disorder of appetite, dyspnea especially, color of skin, cyanosis and paleness or paleness, skin may be regional and maybe full body cyanosis or paleness, pain of in the heart of the heart region in the heart region, headache and palpitation. It's main complaints of patient with cardiovascular systems problem. During inspection of patient, we should change general condition is maybe bad in more correct serious problem of cardiovascular system disorder. Position of child in the bed for babies with problems, especially in when we have cardio insufficiency. It may be orthopnea posture. Physical development proportional or disproportional. So low of physical development is very correct with chronic problem of cardiovascular system, especially congenital heart diseases of babies, or maybe another problem. Deformation of the chest, the cardiac hump, symptom of clubbing, watch glasses is also according to chronic problem, very low time problem for patient with this problem. Color of skin, cyanosis or pallor, such a temperature of extremity. It's depend of temperature of extremity depend of blood circulation in extremity. In some situation, in some problems with heart, we have change temperature of extremity. For example, it's maybe problem with coarctation of aorta. The temperature of extremity is lower than in the center of body. Moisture of skin while mild waiting. Edema of lower extremities very character very often situation with babies with cardiac insufficiency failure, cardiac failure. Pulsation of carotides. It's also according to problems with aortal valve. jugular venous distension, visible pulsation of heart. It's when heart will increase and with low sync with sync of chest wall intact during inspection. No, for example, yellowish head medusa. Its situation is if blood flow to distributed in large vein, collateral circulation quickly develops. Collateral veins can be found under the skin, for example, with occlusion of superior vena cava on the arterial chest wall with occlusion of the inferior vena cava. There in the lower abdomen. It's situation when we have a change of vein, large vein on in collateral circulation. Dyspnea, shortness of breath, can be manifested by increase in tachypnea and in participation of auxiliary muscles. Dyspnea with heart pathology is usually expiratory or mixed. Intensive is in supine position of and wakens when the patient sits down. Shortness of breath can be paroxysmal and accompanied by cyanosis. More often occurs in chronic left ventricle failure, an attack of cardiac asthma. Symptoms of cardiovascular diseases may be, you can see on pictures. Acral cyanosis, for example, on upper extremity and finger near mouth, and clubbing and watching glasses. It's also on upper extremity for babies with long times have problems with circulation. Orthopnea posture. Color of skin, cyanosis or pallor, is caused by a slowdown of peripheral blood flows and an increase in amount of restored hemoglobin in small blood vessels and certain parts of the body. Cyanosis can be localized around in the mouth, perioral cyanosis, on the ends, on fingers and toes, lips of nose and cheeks, lips tip, on tongue or ears, cyanosis, or be more common up to the total. The hue of color of skin and mucous membrane can be pale blue, cherry red, and act. Cyanosis can occur during exercise or persist. The precapillary pulse is found in aortic regurgitation when you slightly press the end of a nail so that a small white spot remains in its middle, expanding and narrowing in sync with the pulse. Deformation of chest and cardiac hump may be such as you can see in pictures. The presence of chest deformities head hump. Its parasternal location with an increase of right heart lateral left. Facies mitralis. It's very often situation for patient with mitral problem with mitral valve, mitral deficiency. Deformation, это мы уже видели. Cardiac thrust, a cardiac impulse thrust appear with increasing and hypertrophy of the right ventricle and heart. Edema, tissue pastility of edema are signs of the right ventricle heart failure. First, swelling appear on the feet and legs, and evening intensifies, and in the morning decreased. With an increase in edematous syndrome, edema can appear on a trunk, lower back, face, genitals, in the boys and body cavities, abdominal and pleural. Cardiac edema moves under the influence of gravity and is more pronounced on side of the body on which the patient lies. Edema of extremities, and especially on upper pictures you can see variants, how check present edema of lower extremities. Palpation. During palpation we check several parameters. It's localization of apical thrust, cardiac thrust, trembling above the mitral wave and its characteristic, presence of cat's paw. Estimation of pulse, rhythm we have change rate, symmetric or asymmetric, synchronic or asynchronic, tension and size. A different characteristic of pulse which can check any doctors, any patients. Estimation of pulse, it's main position of main place when we check pulse at patients. It's according to upper part of body and lower part of body. Palpation of heart region. When palpating the heart region, the apical impulse in the first determined. First, the palm on the right hand placed on left half of chest in the heart area with finger along in the intercostal spaces. Then the final phalanges of finger are moved towards the sternum until the area of maximum pulsation is determined. Percussion. Method of percussion of children over 4 years old is the same with adults. Its percussion is determined for determining of cardiac border of relative heart dullness present on this table. You can see the age under the 2 years old, from 2 to 6 years old, from 7 to 12 years old, and older than 12 years old. It differ upper border and also right and left border of relative heart dullness also change during childhood. It must be used when make a percussion of relative heart dullness. Body of absolute heart dullness also determined from the age of children. It's also on this table you can see these parameters, and you must be used for determine normal or abnormal body of absolute heart dullness. The first during you can see on pictures, you can see how determined by the percussion we can see relative heart dullness. It's according to different age we have different upper border. It's right border also. The first time we found a upper border of livers dullness up to several centimeters, and due intercostal space from the left to right we percussion for determine a right borders of hearts relatively heart dullness. These pictures for how found apical thrust for in this situation in the first intercostal space to the left stemum from the medial clavicular line, left medial clavicular line, and left border of relatively hard dullness. You can see in when we found hard thrust, we in this intercostal space we start from middle by the intercostal space we should determine left border of hard dullness. Sequence of auscultation of heart, especially we have fifth points of auscultations of heart. In these points we should sound according to condition of circulation in different valves of heart. In the first, on cardiac apex, it's to correct to mitral valve. In the second intercostal space to the right of sternum, it's more according to aortal valve. In two intercostal space to the left of sternum, it's more according to pulmonary valve. The valve of pulmonary artery. The place of connection xiphi-sternum to sternum in a little to the sternum, it's tricuspid valves, And the fifth point is place of join 3 to 4 ribs to the edge of sternum. It's according to mitral and aortal valves. You can see real first points on cardiac apex, second points in the second intercostal space to the right of sternum, third points in the second intercostal space to the left of sternum. The first point is the place of connection sternum to sternum and little to the right. You can see here. And fifth point is place of join third, fourth ribs to the edge of sternum. Cardiac murmurs. Cardiac murmurs, additional sound heard during auscultation of heart. Characteristic of murmurs, it's organic, functional, and physiological, cardiac and extracardial and combined. Murmurs may be systolic or diastolic, and murmurs may be timbral, irradiation, force, and duration. It's short characteristic of each of murmurs. Characteristic of murmurs in accordance with modern classification of each motionators. Noise in children is proposed to be divided in 4 groups. It's organic, due to the organic dimension of membranes of heart and large vessels. Organofunctional, due to impaired function and diseases of other organs and system. Functional, due to impaired cardiac function in extracardiac diseases. And physiological, in onset heart and healthy body with a healthy heart due on anatomical and physiological characteristic, the cardiovascular system. Additional method of investigation of cardiovascular system includes a functional test, it's strange test, Shalkov test, Gauge test, and orthostatic test. Also, it's several tests for understanding if we can use it during practice classes. Instrumental methods, non-invasive methods. It's electrocardiogram when we have graphical parameters of bioelectric activity of heart, and its parameters includes an electrocardiogram. You can see its PQ interval, QRS complex, QT interval. It's ratio between different waves of cardiogram. It's maybe on different age. Also, we use X-ray examination phonocardiogram when we fix information about murmurs and another sound phenomena. Ultrasound of echocardiography, ultrasound of heart, very modern and relatively, and Dopplerography, also very interesting methods. No, for example, on X-ray examination we can check parameters of body of heart and the great vessels region. Also, you can see on here parameters of body of heart, different body of heart. In phonocardiogram, we can fix information about sound memos of different variant of this memos you can see on this picture. It's according to different pathology and problems with structure of heart and great vessels. Ultrasound of heart echocardiography we can see especially for heart's cavity and valves. All parameters includes parameters of different functional parameters. We can check it during this method. Check it. Invasive methods includes instrumental method includes catheterization of heart and angiography, angiocardiography. Okay, thank you for attention. More correct information you'll see at practice classes. And today we should finish. If you have questions, you can make it several times.